Hello, everyone. I'm Wendy Myers. Welcome to the Myers Detox podcast. My website is myersdetox.com. And on this show, we learn about all different types of modalities to help you detox your body, but also improve your health. And today we're going to be talking to Dr. Michael Rankin Jr. And we're going to be talking about how to have 100% pain relief using emotional detox techniques and energy medicine as well. We're going to talk about all different kinds of energy medicine modalities. And Michael has so many different stories about how so many different clients that have had, almost 100% to almost 100% pain relief using all the different modalities that he uses. So we're going to talk about all those and more. We're going to talk about the Equiscope device, the Zytoscan, using lasers, using different frequencies. We'll talk about different emotional trauma releases like the emotion code and the E-box technique, and just this is such an interesting show. It was so fun interviewing Michael. He has such fantastic energy. If you are in pain, you need to pay attention, because I think people make the mistake of thinking that if they have this physical symptom like pain, it must be their nerves, or it must be some physical problem, must be an injury, or it must be, that injury, I hurt my knee, I was running too much, or what have you. But the fact of the matter is, pain is a symptom of an energetic block in the body or of past emotional trauma that is manifesting as a physical symptom. And one of the best and fastest and easiest ways to address pain incredibly effectively is with bioenergetics, energy medicine, and emotional trauma release techniques. So we're going to delve into that on this show today. So I know you guys listening to this show are concerned about your heavy metals and your toxins in your body. And so I developed a quiz at heavymetalsquiz.com that will quickly assess your relative levels of toxic body burden of heavy metals and chemicals. So just takes 2 minutes to take it. And after you take the quiz, you get a totally free video series that answers a lot of your frequently asked questions about toxins and how to detox them from your body. So go check it out at heavymetalsquiz.com. So our guest today, Dr. Michael Rankin Jr., and 4 years ago, he began working with his father, Dr. Michael Rankin, to run his cancer and chronic illness clinic. And 6 months in, he started his Doctor of Naturopathy degree with Trinity College. And Michael has 200 hours training with ACIM, the Academy of Comprehensive Integrative Medicine, which is Dr. Lee Cowden's group. And Michael has studied extensively in energetic muscle testing in various forms. And he is certified in assisted lymphatic therapy using a photon sound beam, and uses several different deep cellular detox modalities, such as a laser energetic detox. And Michael has had an office in St. Louis, Missouri for 2 years, specializing in severe long-term chronic pain like trigeminal neuralgia, spinal injuries, and sciatic issues, as well as serious food and inhalant allergies, various autoimmune issues, and autism. His practice brings in people from all over the country and the world. And you can learn more about Michael Rankin Jr. and his work at painfreelifellc.com. Dr. Rankin, welcome to the show.
Hi, thank you so much.
Yeah, so why don't you tell us a little bit about how you got started with your practice and then focusing on pain as your specialty?
Well, 4 years ago, actually this last month in January, I was minding my own business and complaining to my dad about being bored, because I took a few months off in the winter from the job I had had for many years. That I was great because I didn't have to work that much and made a great living. And was pretty bored though. And he asked me if I could help him maybe sell some tests and, just kind of help him out a little bit. And I said, sure, and so we started doing that. And, one thing led to, he was pretty smart and started adding little jobs here or there. And within the first within the first month, I started seeing all these crazy, miracles is the only way I can describe that. People have been through between 20 and 50 doctors. And then all of a sudden, dad would get their pain to go away or their cancer to go away or whatever. And so I realizing that was more fun than what I was doing, I started a degree, doctorate naturopathy degree, just a few months in, and started traveling with Dad to these conferences and learning from Dr. Lee Cowden and, all these different magic tricks to use. And frankly, I never really intended to work on people because that's a great deal of responsibility. And I really didn't want any part of it. I was happy helping in the background. But then, friends start to ask you about certain things to help them with. And so I would, little things, here or there. And then that stuff starts working and you're like, oh, okay. And then once I finished the degree, I opened an office because I had we use a device called an Equiscope, which is an energy correction device. Pretty much everything I do in the office is energy correction. Be it pulse electromagnetic frequency, photon analyzer. I do the Equiscope thing, of course. We've got a couple of our energy correction devices, or emotional release work, is also energy. So that's pretty much it. And so once I got this device, that's seriously a miracle tool for pain. I mean, I've yet to fail to at least cut someone's pain in half, but most of the time I can get it 90% or gone to zero for all sorts of things. I specialize in things like trigeminal neuralgia, which if you know anything about, they call it a suicide pain because it is extremely severe. You got that nerve that kind of spider webs on both sides of the face. And I've had several people tell me it's like a blowtorch that's literally being taken to the side of their face. And it's an unbearable pain, and drugs don't really do anything for it. And, I've had a couple friends that have gone through this. And so the first time I did that, I was like, oh, okay. I mean, I didn't really expect that to work because supposedly there's nothing you can do about it, except for they drill a hole in the side of the head and sever that nerve, which only works about 30% of the time. So, and then your face is numb, so that's not a good outcome for most people. Sciatic pain too, I've found to be incredibly easy to fix. Usually I can get pain that's been there for, like, the first person that I worked on sciatic pain was a friend of mine from Facebook. I had never even met this person before, and she had put up a note talking about it. And I said, I think I might be able to do something about that. Why don't you come on in? And she'd had this for 15 years, all day, every single day, and had been through dozens of chiropractors, acupuncturists, medical doctors, tried all the drugs, tried all the different stretching and therapies and massages and whatever. And it might drop the pain 20, 30% for a couple of days, and that would be about it. And I turned that off like a light switch in maybe 6 minutes. Mm-hmm. And So that's pretty much what's been able to happen with all those people. Serious migraine headaches has become pretty common in my office. One of the things that we do from an energetic standpoint as well is something called a laser energetic detox, where we're able to do a bioresonance scan on the person, scan them for pretty much any toxin that's listed in, this massive 60,000 plus library. And so we can then isolate those and then create homeopathics for them, the same frequency of whatever we want to extract from the body and the cells. And once we push a laser through it and it fans out that beam, and you can just sweep the body with it. And there's a detox reaction that'll happen for most people because it's like a 150-day detox in an afternoon. But I have found very serious allergies. I won't say their allergies have gone away, but all their symptoms have gone away for anaphylactic deadly allergies. Things that would require EpiPen, things that would have killed them before are no longer there. Asthma that was so severe, taking an asthma inhaler every few hours, for years and years and years. And then all of a sudden it's gone. So it's one of those things that's I would never believe it if I hadn't done this myself, and seen the result, and talked to this person myself. It's like so many of these things, because when I first started working for Dad, it was I'll be honest, I've seen him, I've watched him do this work, and I've always been really fascinated, by it for his 10 or 12 years at that time. And but when he would talk to me about the emotional release work and, doing things with like a laser pointer, and I'm like, okay, I guess so, but like I said, in that first month, I saw 4 different miracles. There was 2 ladies with Epstein-Barr. One was, her husband pretty much had to carry her to the car to come to the appointment that one time. She had been that way for a couple of years. And another lady was on disability for over a year and was wanting to go back to work, and both of them had gone to zero pain. And collectively, they'd probably been through 50 or 60 doctors, over the course of a decade, or not a decade, a few years since both of them had been dealing with this. And then I saw their pain go to zero. And I had spoke to these people before and after. So, because I need that, I got to hear this for myself. I'm fairly skeptical when it comes to these crazy kinds of things. Not so much anymore, Epstein-Barr, fibromyalgia. There was a stage 4 liver cancer lady that was in that first month too, where, she was in a 10 out of 10 pain for almost a year and wasn't able to work anymore. And she was a very well-known facial reconstructive surgeon. So she had a very successful practice and had friends high up the food chain at some of the major cancer hospitals around. And I talked to her husband the day before. We overnighted some testing kits and things. And she had told him that she was going to call in hospice because they had found another tumor, a 4th tumor, now totaling 19 centimeters on her liver. And the pain was so crushing, she was done. She was just going to call in hospice and get it over with, And so when I saw Dad tell her to take an Epsom salt and baking soda bath, and it cut her pain in half, right? So she calls back crying, like ready to live again. And then the next day, he's like, so do you trust me a little bit now? Because about a Western trained medical doctor, you can't really talk to them too much about emotions being such a huge role in chronic illness and pain and things like that. So, but when you cut someone's pain in half, they'll do pretty much whatever you tell them to after that. So she did an hour of emotional release work, maybe an hour and 20 minutes, I think, and it was gone. To like a 0.2 or 3, I think I remember she said. It's a number of years ago. So after that, I was pretty convinced, and I just kept seeing it over and over. And so, yeah, I opened my office about 2 years ago. In April, I think it'll be 2 years. I started off specializing in pain because that's what I knew how to do, through Dad and learning all these different techniques. And then, other things will come in and, oh, okay, well, yeah, let's see if this works. And hey, it did. All right. So anyway, that's kind of like my total backstory there.
Yeah, and your dad is a very esteemed Dr. Michael Rankin, and this is so exciting that you're talking about this and using bioenergetics and energy medicine to address pain, and that's why I wanted to have you on, because I truly feel like this is the future of medicine, and I think people get stuck in this realm that the physical body, if you have a physical pain, there must be some sort of physical solution. You need to take some sort of drug. I know that people, they get so sick of taking pain medications and just feeling foggy and having all of the nausea and the side effects from those as well. And they don't realize there are so many things that they can do. Can you talk about some of the bioenergetic modalities that you're using? You mentioned the endoscopy. Can you tell us what that is exactly?
I do get that question pretty much every day. And my easiest answer is it is an energy correction device, energetic flow correction device. So what it's doing, like use different probes or plates or whatever that you would attach to the body in various areas where the pain is, right? It's basically communicating between the device and the person's body a couple thousand times a minute. And it's seeking out those blockages. And it's literally correcting them nearly instantaneously. And that's why I can, get a pain, I can turn someone's headache that's been there. I literally, I had someone come in about 4 or 6 months ago, 50-year-old woman who had a headache every single day of her life, all day long for 40 years. And about a third of the time, they would turn into full-blown migraines where she'd be bedridden with a mask and an ice pack, And she came in for something else, like it was some anxiety and some gut issues. And she goes, well, yeah, I've got this headache. I'm like, oh, well, hey, let's put a little headband on you and see what happens, And literally, the standard cycle of frequencies that I move through is about 5 or 6 minutes. So I just did the standard cycle on her, and I muscle tested her for the ones that would work for her specifically out of these, 20 or so that I use. So about, my little timer went off for my, 5-minute whatever. And I said, so, how do you feel? How's the headache? And I always pin them down. You have to in the beginning, like on a scale of 1 to 10, 10 being a broken bone, where's your pain level? She's like, oh, it's about a 4 or 5 today, not too bad. That was a pretty good day for her, And so I said, so how's your pain? And I get this all the time. People who've been in pain for that long, they don't know what to do. They don't even recognize what it's like to be out of pain anymore. So hey, so where's the pain level now? She's like, well, I don't know. It's definitely less. And I was like, well, it was like a 5, 6 before. What is it now? What number would you put on it? And she sat there for like another 10 seconds and was like, it's 0. And her eyes, she can't believe what happened, And so, and I see that kind of thing all the time with headaches and whatever. One of my very favorite migraine stories is this woman that I was actually friends with, and she had been dealing with migraines and anxiety and depression since she was about 12 years old, and when she hit puberty. So we had actually done quite a bit. She's a nurse and really good about keeping a diary she had for many years, when the headaches happened, how often, how long they lasted, what preceded this, what did she eat, what did she drink, things like that. And so she 48% of her days were migraines, right? Where she would stay at home from work, and sometimes they'd last for a couple of days. The one that got her finally to listen to me and come in had lasted 2.5 months. So she was on disability from work. I can't either.
I can't imagine.
Me neither. Me neither, man. So she came in. I did. I'd already worked on a couple headaches. So in the first, I think it was the first session or maybe 2. It went from 48% of her days to like 19. And then I think we did a third session and it went down to like 10%, because we're tracking this over a month period, and then we kind of stagnated for a couple of months. And I was like, I was muscle testing her, and there was toxicity kept coming up over and over. So I was like, let's try laser detox and see what happens, And so, and this freaks me out still. She calls me the next day and says, hey, I don't know if this is too much information, but I just went for my morning bathroom break, and all of a sudden my bathroom smelled like a hair perm solution bottle had just dumped over. And I was like, oh, okay, well, did you get hair perms? And she's like, yeah, I did. The last one I got, I was 15. This woman is 41 years old. Okay, so 26 years ago, 25 years ago was her last perm, and that stuff stayed trapped in her body for all that time, and we extracted it with light.
I've got a few of those perms, and I'm a little concerned about that. I had like an afro at one point when I was like 10 years old.
No kidding. Oh my gosh, I gotta see the picture.
But I'm waiting for the smell to come out in the sauna. I've heard of people that got perms like doing infrared saunas, and the smell starts coming out of their body because it's exiting. But yeah, it's crazy how these toxins stay in us for decades.
Yeah, literally. I've done this on a bunch of people now. And so like another guy was a professional painter, like a union painter, painting houses and stuff like that. I had been doing it for like 12 years. And the next day he called me and said it smelled like a paint can in his bathroom. I did it on another guy who was 54, 55. And I was trying to reduce tinnitus, but it didn't really do much for that in all honesty. But the next day he called me and said, hey, because I started telling people, watch out for any weird smells, And so he called me and said it smelled like in his bathroom, it smelled like a burning car, like gasoline and oil and rubber and stuff, right? And so he said it smelled like his dad's garage, his mechanic's garage, where he worked for like, I don't know, 8 years or 10 years maybe. And the last time he worked in that garage, he was 23, or 24 or something like that. So again, 30 something years, these fumes are trapped in this guy's body. And the fact that you can extract it with light and frequency freaks me out no matter how many times I do it. but it's so cool.
So tell us about this.
By the way,
Yeah.
the first migraine lady, no more migraines after I think she's had two maybe three in the last 8 months, something like that, since we did it. Yeah. So
and that's after one treatment. Is that's the bioresonance machine?
So I use a bioresonance scan. I use Zyto, is one we use.
The Zyto, okay.
Yeah, and then because I can actually output, the vials from that same, device. And so, yeah, I just, create the vials and then laser her. We do several different ones, we do like the heavy metals, vaccine nosodes, microbes, all the megatoxins, stuff like that.
And so how does that work exactly? So you create these vials, so they have frequencies in, say, the frequency of mercury, for instance, or the frequency of lime or what have you. And so you take a laser, and so you shine it through that and then to the person. And so how does that all work?
So literally, I mean, you just, they're in, they can be light clothes as long as if it's light colored, because dark clothes absorb too much light. So I'll have them kick their shoes and socks off. You got to hit the reflexology points in the palms of the hands and the feet. That's really, really important. I was told by Dr. Cowden, who developed this procedure, who taught it to me, So, and then you just that beam will fan out, kind of like a little broom. And so you just sweep up and down their body, I don't know, maybe 10 times. I make sure I hit the ears really good to do all the, different acupuncture points are in the ear. You just hit them. In most states, it's, you can't, they consider shining a laser pointer on an acupuncture point, practicing acupuncture, and I'm not an acupuncturist. But if you just stand back across the room and fan that beam out and you hit all those points, it's, pretty good to go.
I had Dr. Doug Phillips on my Heavy Metal Summit talking about how he detoxes people.
Yeah, I know Doug Phillips. He's a very nice guy. Yeah, I met him. He's a part of ACIM, where I learned, obviously I learned a lot in school. But to tell you the truth, and nothing against that school, they were wonderful, wonderful people and good teachers. I love them all. But all the actual magic tricks I used to really heal people, I got from ACIM, Academy of Comprehensive Integrative Medicine. So anybody out there who wants some really cool, like magical medical techniques, that's the place to go. And he got, Dr. Cowden's such a sweet and brilliant man. He gets, all sorts of really famous doctors that come and teach people and, learn all these cool different modalities.
Yeah, I met Dr. Lee Cowden. He's Dr. Mercola's personal doctor, and he's amazing. I mean, he's just so brilliant.
Yeah, he is. He and my dad have been friends since like 1975 or something. So, I've known Lee's been coming over to our house since I was a little kid. And, I didn't really have much contact with him, since I was probably 18 or 19 when he saw me as a patient. But then I started, I'm not going to lie, like Dad had to kind of drag me to these conferences at first, because I really honestly had no intention of working on anybody myself, because frankly, I've spent a lot of my life, I orchestrated the job that I had, in sales because I didn't like working that much. And I certainly didn't want any bunch of responsibility, I just kind of like doing my own thing. But now I seek out the hardest cases I can find. When somebody tells me they've been through like 30, 50 doctors, I can't wait to get to the office.
Yeah, it's like a puzzle to figure out. But you trained with the best, Dr. Lee Cowden and your dad, Michael Rankin. And I mean, you died. Dr. Norm Shealy, comes, and I've learned many things from him. He's probably arguably one of the most famous pain doctors and neurosurgeons like in the history of mankind. The fact that I even know this person is pretty staggering to me. You get to learn from people like that. ACIM really draws so many really just well-known, and I don't mean, successful as in financial, but successful in healing people, so that's where I really got to feel so unbelievably blessed to pick up all those tricks I did. Yeah, and so are there any other bioenergetic modalities that you use besides the Equiscope and the Zyto?
Oh, sure. That's the go-to usually. But like I've got something called a Biophoton Analyzer, which is really, really cool. A guy named Alan Back designed that, who used to actually make energy weapons for the military. and decided to start making energy healing devices instead when he left that. That's a really cool one. You can actually take someone's DNA sample and throw it in the well all by itself and output. It will actually analyze their DNA and then make corrections for what it considers to be the highest priority, of something that might be in dis-ease in that body. And that one, it's funny, like, because God bless my dad, he is a device junkie. Like, he just, any cool medical device, he's got to have it, And so, like, a Biophoton Analyzer, like, I got his old one when he wanted the new one that was more automated, and I didn't really know what to do with it or anything like that. And I just started playing around with it. And one day, a guy comes into my office. I was working on his autistic son. I work with a lot of autistic children, too, doing the detox and energy correction with some really, if I could just fix those kids all day, I would. That's my real passion is there. But so this guy brings his son in, and I've met him several times by this point, So when he comes in and I'm working on his son over in one part of the room, he starts telling me, I can hear him breathing, like, from across the room, and like wheezing horribly. I was like, what's going on there, buddy? I've never noticed that before. And he said, yeah, I think it was exposed to mold like a month ago. It's been like this for a month. I don't know what to do. So I came over, I had him stick his hands in this well. So it'll antidote and neutralize either one, right? Or this person while you're doing it. I just hit the button, it was about a 2-minute cycle. And I went back to working on his son. And about halfway through, he goes, hey, how long is this supposed to work? Because I feel like I'm breathing better already. So the dinger went off, and I go, so take a deep breath. And he's like, his eyes bug out, and he's like, I don't think I'd taken a breath that deep in 10 years, So and then I also used that friend, this woman who has become a good friend, was poisoned with metronidazole. And like, she went through this, what was supposed to be a simple medical procedure. And they gave her this. And a few days later, she woke up full body paralyzed, and like literally couldn't move for several hours. And her boyfriend had gone off to work already. And so she was obviously in a full on panic. And then like her 20/20 vision went blurry. No energy. There was incredible amounts of brain fog, shooting neurological pain going, from the neck down all over her body. It was unbelievable. I mean, the list of symptoms was a mile long. And so we had already done a whole lot of work on her and had negated about 90% of those symptoms, pretty much everything below the neck. And she came in one day and said, hey, I was still, I've still got this brain fog and this other stuff or whatever. And I said, well, get a sample of that metronidazole, bring it in. So I just put it in the well with her and a DNA sample, and I antidote, neutralize that, and it creates a remedy for it, right? So I just lasered her with that. The next morning, again, after you laser someone, they've got to be off of electronics for like 25 hours, okay? So she calls me like 25 hours and 1 minute later the next day and is like, hey, you got to hear this. And she tells me that she was just sitting there watching TV, and she felt all of a sudden like I think she said there was like a little pop that she heard. And then all of a sudden, she felt this fluid coming down through her face and through her neck. And then all of a sudden her brain fog was pretty much gone. So she wouldn't let me do that again though, because it freaked her out a little too much. But yeah, that was really cool. Autistic kids, who won't look their parents in the eye, laser detox is the first thing I start there. We'll do a little energy correction work on their gut. I do some high frequency stuff, and they're shedding parasites like a house on fire the next couple of days. So that's pretty cool.
Yeah, no, autistic kids, they have terrible gut dysbiosis, which is a contributor to their inability to detox in the first place.
Mm-hmm. Yes. So that's been, when you get calls from parents and, my 8-year-old is looking me in the eye for the first time, that is a just mind-blowing moment, kids. Dr. Cowden, I haven't experienced this yet, but Dr. Cowden was telling me he's done this on kids like who were nonverbal at 10 years old. And then a couple hours later, they start talking. It's the craziest thing. We do a lot of pulse electromagnetic frequency, mineral cascades. We've been told by the guy who kind of designed this protocol that it clears out, plaque in the arteries and the heart, things like that. Kidney stones, and we'll start to break those up or soften them anyway. And, that was another thing. We're like, yeah, okay, sure. But we had this guy who does these kind of full body sonograms, and had come in and did one on Dad, and he checks like arterial health and blockages and things like that. And Dad actually, he's almost 70. He's got some blockage there. And so he did, and this guy was coming into the Dallas office about once a month or so for other cancer people we were working with. And so I think he said he dropped it like 70. He had cleared up about 70% of the plaque in his arteries in just a little over a month doing the PEMF Mineral Cascades. So that's a really cool thing we've been doing too. And so many people are on, so critically low on minerals anyway. Their bodies aren't conductive, which, it's kind of the root of all evil, if you can't move electricity like it's supposed to through the body, because we are electricity. Not we run on it, but we are everything, every cell, so.
Yeah, that's what I've been trying to tell people for 10 years. You're deficient in minerals. You have to have minerals, or they're spark plugs of the body. If you don't have that, nothing is going to work. But that's interesting. Tell us about the mineral cascades. Like, what is that exactly? Is that the download of the frequency of minerals?
So we actually use liquid minerals. We get them from Mother Earth minerals that are a very specific type. Like I think it's called a double plus calcium, or maybe even a double negative. I don't recall, but it's a very specifically charged type of calcium that they use. Dr. True Ott kind of came up with this protocol. So we'll put them on a QRS, PEMF, pulse electromagnetic frequency mat, to open up those cells, right? And so then we start off with calcium, then we move to magnesium, potassium, and then zinc. And that particular cascade is well known now to do all sorts of things, especially infuse minerals into the body, but also for the the breakage of the cholesterol in the arteries and things like that. It seems to work really, really well.
Fantastic. Yeah, that's interesting. Use the PEMF mats. Those charge up the cell voltage. A lot of people have low energy cell voltage, and their body's just not working and not communicating properly.
Yeah, that's right, and that's what it's all about. When I started working more with the energy, the meridian system of the body, that we've known about for 5,000 years now, my pain relief success level I was already probably helping 80% that walked in the door. But once I started working with that electrical system and just kind of opening those things back up, for sciatic pain, I've noticed that if it's always going down the gallbladder meridian. Gallbladder 30 is kind of right on the side of the butt there. Mm-hmm. And, and then, so if, gently press around on that, and if it lights them up, that's a weak point, right? And then you can either muscle test what the other weak points are going down that line, or, gently, if you don't have that ability, just gently press on those points, because it will light them up with a lot of pain if you press too hard, if it's a weak point. And then, so I'll put something on the end of the foot at gallbladder 40, one on the butt, and just boom. And it literally, that's it. It's gone, inside 5 minutes. It might take less than 5 minutes. That's just, that's how long the cycle takes. So I don't have them get off the table until then, Mm-hmm. But yeah, it's every single time so far. And I've done it on at least a half a dozen people.
And is there any other tools that you're using that I think the audience would be interested in hearing about?
These guys right here, okay, are created by a guy named Nick Lamoth in Oregon. These are medical devices, actually. They're inputted with a couple thousand different mathematical calculations of frequencies that they've devised, and isolated that, hey, this will be helpful for various things. But they've got literally a couple thousand different combinations in here, as well as like light, mineral, sound frequencies as well. And this is another one of these things that Dad sent me one day with zero explanation whatsoever. And I'm like, oh, yeah, okay. And they literally, I put them on my dining room table where they lived for probably nearly a year. And then he starts telling me all these things that he's doing with them, like with brain work on people, right? So we'll muscle test where to, put these on various parts of the brain, or acupuncture points or whatever. It's really interesting. You get them on whatever part of the brain, like right back here is a real hot spot for people usually. and their body will sway involuntarily until like in circles, or like one lady kind of just leaned over and like was almost falling over. I'm like, is that what your body's naturally doing? She's like, yeah, I can't, I don't know what else to do with it. And then it will slow down, and then they'll start moving, either they'll stop or moving just in a forward backward motion, and then it's unwound. So so this is one of those things I was like, oh, okay, that's cool. And I can feel that in my own body. And that's a unique effect. It's pretty eye widening. All right. But what is it doing? Right. I couldn't really pinpoint anything. I'm a fairly healthy person. I didn't notice any after effects or anything. So I'm talking to the guy, Nick, who makes these one morning, and the woman I was telling you about with the metronidazole poisoning, right? So she, calls me up for pretty much anything that happens now. And so she had smashed her head on some kind of cabinet or something right on the top of her head, and it gave her a minor concussion, and it threw off her equilibrium. So for 3 weeks, she's bumping into stuff, falling over, nauseous. She felt like she was seasick, blurry vision, things like that. She walks in right as I'm talking to this guy, and I go, hey, and I have him on speakerphone on my desk. I'm like, hey, by the way, Nick, I've got this young lady that just came in. Can these things do anything for equilibrium problems? And he's like, oh, heck yeah, so easy. He has me take one of these, and he has me put it on just behind the crown chakra, right? It's called, I think it's governing vessel 20. So they call it a point of 1,000 cures in Chinese medicine, right? So he has me put one of these on there, and has her change her depth perception. So she looks down at the floor, back at me, over me, back and forth, up, down. I have her look outside and span around, sit up, sit down. Literally 90 seconds, gone. Okay, no more symptoms at all. So, that was another one of those where I, once you see them work, now I carry these around with me everywhere I go. I've used them for anxiety. Myself, I struggle with sleep every now and then, So one morning I'm watching TV in bed, and I was like, oh, I took out my little trusty acupuncture app and type in sleep, and it's, a couple long points. There's points everywhere. So I'm just kind of, stick them on there and watch it. I'm like, oh, I think I'll move them a couple minutes later. And I slept like a baby that night. I got a tracker, so I can, I was like at 85%. I never get up that high. So that was cool.
Nice. I'll have to get him on the podcast.
What's that? Oh, yeah. Oh, you should.
Yes.
You absolutely should, man. He does all sorts of cool things. A lot of allergy work is what he does. Is a main focus for him. Yeah. I'll definitely put you in touch with him. He's an awesome guy. Super, super nice guy too, and brilliant.
Yeah, and let's talk about emotional trauma. So I think people really are not aware of, or they underestimate how much their trauma in childhood or even recently parlays into physical symptoms. And this is something I'm talking about more and more and more. One of my best friends is Nikki Grodrix, who's a world expert on emotional trauma. So talk about how that kind of plays into your practice and what you do to release it.
Well, if you talk to any of the doctors we know and run around with and share patients with and things like that, it's all chronic illness, pretty much comes from a trapped emotion and trauma. It's like a frequency ping, if you will, that just kind of will stay trapped there. Seriously, this is one of those things where Dad had been telling me about it for 6-8 years or something by that point. And I was just in the back of my mind, I never say this to him, but I'm like, Dad, you're probably getting like the supplement and device combination right, and that's like a happy accident, whatever. I just couldn't wrap my head around it. I just couldn't buy into it. And but like I said, that first month when I saw 4 people get out of agonizing, crushing pain in an hour, and altogether they'd probably seen 150 doctors, over the course of 5 years. It's crazy. So then I started reading a little bit, what is his name? The German guy.
Dr. Hammer.
Yeah, that's him. Yeah. Started studying that, German New Medicine, and, just listening a lot, listening to, because Dad won't give me any specifics about patients or anything, but he'll say, this person was struggling with a lot of anger, that goes to your liver, grudge will go to gallbladder, fear goes to kidneys, sorrow and loss will hit your lungs, shock obviously will go to the heart, things like that. And Dad does EVOX. Well, like there's several main modalities for that. Like EVOX is one, I think, kind of pioneered by Dr. Cowden. And then Emotion Code, Body Code, Bradley Nelson is that guy, wrote that book. And then Recall Healing guy, I can't remember his name off the top of my head. But Dad really kind of employs all three of those. Because he told me why. He says they're too slow and he gets bored. So he really if I people that come to me before Dad or will reach out to me first and say, hey, I saw this video or I saw this testimonial video, can I come in too? And they'll come in and like one particular friend of mine came in for some all over body pain and specifically more sciatic, but it was really from kind of head to toe, and had spent thousands of dollars on different clinics and doctors and spas, massages and whatever. And she came in and I got her to 0 point for the first time in several years in about 20 minutes or something. And I told her, I was like, so when did this start? When did the sciatic pain start? And she said, well, it was about, maybe 4 or 5 weeks ago. And I said, well, what happened around that time? You're grudging on someone. And she had gotten into an argument with her husband. So she left and pain-free. And then a couple, like, I don't know, maybe a month or two later said, hey, I need to come in for a little tune-up. It's starting to creep back. I'm like, you got in a fight with your husband, didn't you? Yep, I sure did. So anyway, but the ones I struggle with that I can't fix in my office in short time, I turn them over to Dad and he usually gets them over the finish line.
Right, fantastic. Yeah, I think emotional trauma, like I mentioned, is just, we all suffer from emotional trauma. Even if you haven't suffered severe emotional or physical or sexual abuse, we all have things we weren't emotionally ready to deal with. But if you have suffered from severe abuse, you want to be looking at that underlying link to why you're having physical or emotional health issues or pain syndromes. And you need to be addressing that for sure.
Yeah, for sure. Because like I said, that's kind of the root of a lot of, if not most of it, unless it's some kind of toxin exposure. And I'll tell you, so the first ACIN meeting I went with Dad, I had gone to a couple of other conferences or whatever. And frankly, they were kind of, there were a bunch of marketing stuff and I wasn't really learning all that much. But then ACIN is completely different. They're just all about teaching and stuff like that. So I went to the big meeting they have once a year where all these famous doctors come in and do their lectures and all their different modalities. And I remember, I'll never forget this, because I was only a few months working with Dad by this point. I had seen all these crazy miracles with emotional release work, but I was still kind of in the back of my mind, I'm like, there's something else, there has to be, right? It can't be that easy. It can't be that kind of thing, And so the very first lecture I go to, there's 3 lectures a day, or 4 lectures a day for 3 days in a row. So I heard 12 of world famous doctors all talking about, their special modalities, like, or their specialties, gut health, cancer, dentists, anything, toxin specialists, brain specialists, anything you can imagine, right? And so I'd listen to these people talk for, hour and a half lectures each. And the whole way through, they're talking about their different modalities and whatever, and then their success and how they've implemented it. And then almost uniformly, they damn near repeated the same thing. But in the, yes, we can fix the gut here or the cancer here or whatever. But in the end, it all comes down to what trapped emotion got you there in the first place. And if you don't deal with that, you're kind of throwing water into the wind, And so I'm hearing this over and over and over and finally by the third day, and I'm pretty sure the last one I heard was this really well-known biological dentist named Stuart Nunnally. He had worked with Hal Higgins for a long time, and it's a really great guy. We sent a lot of people to him. But so and I had heard a lot of people talk about, tumors and other, ailments, diseases that will affect certain organs or whatever will be tied to a bad tooth, right? And I've heard this over and over and over again. And so I was really interested to hear this guy's presentation. And so sure enough, he's going through all this and he's like, listen, I don't care if it's liver disease, a pancreas problem, if your lungs are being affected or you got tumors here or there, you can almost always track it back to a bad tooth. He goes, but before that, it's a trapped emotion. And that's what will affect that tooth. So as I heard this dentist say this, and this is I think I'm nearly positive it was the last one I heard. So I left like full on convinced, like there's really something to this, and now years later, it's one of the first things I'll ask people, when did this happen? What exactly happened on that day? This is a wonderful example. This young lady, she's about 34, comes to my office maybe 4 or 5 months ago, and starts telling me, she came in for some neck pain, which we fixed in like 5 minutes. So then we're just kind of, I always ask people, because I charge, $165 an hour, and I don't want to kick them out in 5 minutes. I'll start doing some other systemic work on them, even though I fixed their problem that they came in for. And so we start talking, and I was like, so do you have any other, kind of issues that you might want to deal with? And she's like, well, I've been getting these urinary tract infections, out of nowhere. Like I've never gotten them in my life before. And I remembered something Dad had said to me like 3 years prior at some conference we were at, that bladder issues will be a territorial problem. Somebody's invading your space or something. And so I just said, I go, so when exactly did this start happening? And she's like, well, it was almost exactly 6 months ago. And I was like, so what in your life, did something change significantly in your life? And she goes, well, yeah, my boyfriend and I moved in together. And I just kind of chuckled, and I was like, is he a little overprotective maybe? And, kind of invading your space. And she's like, what? Like, how'd you know that? And I just was giggling, So anyway, that kind of, that sort of stuff is all the time. We see it. It's just so funny to me.
Yeah. And addressing emotional trauma, you're still addressing the body energetically, because all these emotions reside in your energy field. The scientists have searched for years trying to figure out where are these emotions. They're not in our physical brain cells. There's no physical place in our body where these emotions reside. They are in our energy field, and they have to be addressed energetically to release and transmute them. And it can be done very, very easily. People don't realize how easy it is to get rid of trauma and negative emotions.
Truly, and it does come down to the practitioner too. We've certainly had plenty of people who have, it makes me laugh pretty much every time when I'll, be talking to someone new, because I'm the person who, everyone that calls in to work with Dad goes through me, so I hear all their stories, and I'm the one who sets up their appointments and things like that. So, I'll be talking to someone and say, I'll ask them certain questions, or whatever, to try and give Dad a few notes, before he just dives in or whatever, just kind of give him a heads up. And every once in a while, I'll get someone's, oh, well, have you done any, like trauma release work or anything like that? Oh, yeah, I've got a lot of trauma, but I've dealt with all that stuff. We're all good,
Oh, yeah. Everyone thinks that. I thought that too at one point.
Yeah, me too. I'm guilty of it. We all are, I think, It's not the same as locating and isolating where that trapped frequency is, because that's what it is, And one of these, it's so funny that one of these particular ladies I'll never forget is, that, I've done all that work. I've done it for 10 years, blah, blah, blah. I don't need any of that. So she goes on to Dad, and he tells me the story later on, after her appointment. She went in, literally one of the first things out of her mouth in the first 3-4 minutes of this talk was, how was your life growing up? What were your parents like? Oh, I had the most Pollyanna life, because Dad starts muscle testing people right out of the gate. And it's like, oh, what's this thing with your mother? There's something definitely with your mother there, and Dad and Mom and blah, blah, blah. And she's like, oh, no. Yeah, there were some issues, but I really had a Pollyanna life growing up. She literally used those words. And then 20 minutes into the session, she's mother effing dad, mother effing mom. I mean, it's crazy stuff, you know. So anyway, I think that's one of dad's true gifts, is to be able to get to the root of these things pretty quickly.
Interesting. Yeah. And so can you tell us where we can like learn more about you, work with you? I'm sure you've piqued the interest of the audience here. So how do we work with you?
You can call me at 314-546-5128. That's 314-546-5128. Or painfreelifellc.com. That's painfreelifellc.com. I would suggest going to the testimonial page and just start going down the list. You know, the top one is some lady who, this is a great story, who had gotten herself off the kidney transplant list after, like a year or something. And she's 70 years old in pretty much total kidney failure. So she was not going to make the 5-year waiting list and was refusing dialysis. And so started doing some work. She actually, was really funny. I didn't find any of this out until the testimonial she did. Told me that she was actually, kind of throwing Hail Marys and thought, I guess I want to live for my husband, so I'll do some research. And she started looking up, she found some kind of really well-known kidney doctor and actually was able to contact him and started talking to him. And he's like, you know what, I don't think I'm the one for you, but I think I know a guy who might be able to help you, and send him over to Dad. And so she started doing a bunch of emotional release work, and she didn't have a lot of money, so she didn't do a lot of supplementation or things like that. And I think Dad was donating actually a good chunk of time to this wonderful woman. She's become a dear friend of ours. But she got off the kidney transplant list and was out playing pickleball with her buddies for like 4 or 5 hours a day, smoking all over the other old ladies,
It's wonderful to hear stories of recovery like that, because it is true. And it's like, you can have this radical remission, and it's not, it's not relegated to some sort of, miracle or how did that happen? I mean, there are, these devices that you're using are firmly rooted in science. This is the new medicine. This is how medicine is going to be practiced in the future, because the old paradigm doesn't work for managing chronic conditions.
That's right. All you do is end up creating more chronic conditions. And, I'm sure we can all agree we'd probably be a light year ahead of where we are now if all these things hadn't been suppressed.
Yeah, because I've dealt with chronic pain myself. I mean, I had, after I had my baby, I had a C-section, and as I started working out at the 6-week mark, I was just doing some, super light yoga. I mean, I literally lifted my leg up and pulled a muscle, my piriformis muscle, and I was a mess. I was in pain and I could barely walk 10 minutes, and it was terrible. And then when that got a little bit better, I started lifting weights, and of course, one of my discs slipped a little bit. And then that was, a couple of years of physical therapy and decompression, doing all this stuff. And I was taking Vicodin for the pain. And it was just, my life was miserable for a couple of years because of that. But that's, kind of at that time, I discovered Nest Health Bioenergetics and started doing emotional trauma release and identifying my emotional trauma in these scans. And I felt like I had, was doing physical stuff, but I thought this emotional trauma release played a big part in my pain coming under control completely.
Yeah. And even from an injury, right? Or what you consider was something you did. And I brought that up to Dad many times, because I'm like, well, they pulled something or was running, and all of a sudden something was painful, and he's, informed me that those are weaknesses that are there already, that are created already, and wouldn't have probably happened had not there been that frequency weakness there already.
Yeah, so it's just an energetic block, or
it's truly fascinating. I find this like real life magic.
Yeah, absolutely. Yeah, and I find it absolutely fascinating, and that's why I wanted to have you come on and kind of, I'm trying to have person after person after person come on and talk about how you address the body with bioenergetics, because this is what you want to be looking at. It's not about just taking medication, suppressing symptoms, or even just taking supplements. Those are great, but there's very easy, quick ways to address our physical health ailments, or what we think are physical issues.
Yeah, that's right. Yeah, that's right.
So Michael, tell us again where we can find you. And do you work remotely with people?
Yeah. I mean, until a few years ago, Dad's practice was all remote for the most part. I mean, he would help, a few friends out from church or whatever in Dallas, but that was pretty much it. I mean, we've probably got people in 7 or 8 different countries right now, and we travel a lot because we have a lot of people that are unable to travel, or they're just super wealthy and don't feel like making the trip, and it's worth it to them to bring us there, and that's fine. So we do travel a lot. Go to the Pain Free Life LLC website. If you go to the testimonial page, you're going to see everything from, again, kidney failure being resolved, getting off a transplant list, to the very first person I did a laser detox on was deathly allergic to all food. I mean, literally, according to skin and blood tests, allergic to all food. We'll go through like 4 to 8 EpiPens a month. Hadn't eaten a single bite of food without a handful of Benadryl, in 17 years. And an asthma inhaler every couple of hours, again, for 17 years. This was an injury. I'll leave out how, Yeah, I did laser detox her one time, and she got pretty sick from it. She's a fairly sickly person, had been taking all these different drugs for, nearly 2 decades. And she didn't, I reached out to her several times over the course of like a week and a half period. And I thought, and she wouldn't get back to me. And I thought it was kind of rude. I was like, maybe I guess I made her sick and it didn't work, and she's just pissed at me, Well,
she was eating. She was busy eating.
Yeah. Well, no kidding. She calls me and sent me a message, and she's like, "Hey, I'm so sorry I've been out of touch, but I didn't want to jinx anything." She's like, for the last week or so, I have been eating whatever I want. I have had no asthma medications. And I mean, it was unbelievable. Her life had completely flipped around on a dime. Now, in all truth, she's backpedaled a little bit, so we've had to do some other work on her. But I mean, this is the most significant symptom list of any human being I had ever come across. And when it came to like food and inhalant allergies and asthma symptoms, I mean, she had been in the ICU like 26 times in 2.5 years. I mean, she had died once, and she asphyxiated to death in the back of an ambulance, and they brought her back. But I've done this several more times now on people with asthma, and all their symptoms are gone. There's no more medications that are needed, especially for some of the ones who might hit an asthma inhaler, every once in a while. They just don't use it anymore, So that's been very cool. Autistic kids, like I said, I really like working with them. Migraines, all sorts of kind of severe pain. I tell people this all the time. I don't care what your doctor said. I don't care how many surgeries you've had, what the injury is. It's really not that relevant to what I'm doing, moving energy around. I've caught people who have, a buddy of mine had a surgery where his bones, he's just got some kind of degenerative disease where his bones were brittle. And they were worried, and he was a motorcycle racer on top of it. So he had a metal titanium rod inserted inside of his femur, right? And then they were going to do the other one, the next year or whatever. So they screwed this thing inside of his bone. That is a major surgery, right? So he came to see me about 3 or 4 days after the surgery was done. And, he comes in on crutches, and he's limping and, doing all this. And he's in like 6, 7 out of 10. And he's taking the drugs, So I worked on him for maybe 20 or 30 minutes, and he pops off the table in 0 pain. Okay. I couldn't believe it. He starts walking around. I'm like, "Whoa, dude, just because there's no pain doesn't mean you don't have to take it easy. That's a really serious injury, so you got to watch that." And, so anybody can see, I started doing the testimonial videos. They've turned out to work pretty good for like marketing stuff, but that was not my intention. That's not why I did it at all. I did it because the first couple people that I had done these crazy procedures on had these results, and I didn't think anyone would believe me. And so now I'll tell people, because, when you start, be out at a dinner party or something, and you start talking, "Hey, what do you do?" And, "Oh, that's cool. What do you do?" And I'll start telling them these crazy cool stories because they're super fun, And you can see their faces kind of gloss over a little bit. They don't believe half of what you're saying. I'm like, here's my card. Go to the testimonial page. You don't have to believe me. See if you believe them. So yeah, painfreelifellc.com, or you can reach me at 214-566-5698. But my main number is 314-546-5128. I'm in St. Louis, Missouri. Dad is also, well, he's about an hour outside of St. Louis. So both our practices are here now, but we really collaborate and work together pretty much on half the people that come in, So yeah, it's pretty neat. But we do travel everywhere. Like I was in Spain a couple of years ago working on somebody who had a serious brain injury, and we'll travel all over the place.
Yeah, and I think this is something that can give hope to so many people, because it's such a pet peeve of mine when a doctor says there's nothing more that we can do, or there's no cure, or there's no treatment for this. There is always something that you can do. Always.
That's right.
You're just talking to someone who has a limited toolbox, or who doesn't have the curiosity to go out and learn what it is that would help their patient population.
Yeah. And that's, either they're lazy or I don't know. And not all of them are like that. It's, although I've run into many, but it's just, they've got, like you said, they've gotten to the end of their toolbox, and that's what they know, I mean, let's be honest, Western trained medical doctors are pretty catastrophically undereducated. I had some young guy in my, and this was, I had just gotten the Aquascope device. And I was working on my friends, just kind of get some practice and hours built up with it. And one of my cousins, whose friend just is finishing his residency from St. Louis University here. It's a very it's a good medical school. It's not like he went down to Tijuana or something, right? And he came over and was asking me questions because he had heard some stories from a cousin. He's like, "Hey, how does this thing work?" I'm like, "Well, it's an energy correction device, and we're opening up the flow of the meridian system of the body, and blah blah blah." And he's like, "What do you mean?" And I was like, and in my mind, never in a million years, Wendy, did I think that this guy didn't know about the meridian system of the body. I just figured there had to be some fancy Western medical name for it that I was unaware of, right? So my acupuncture doll sitting right there. I go, the energy system of the body. And he looks down at the ground and he's like, "I've never seen that before in my life." This guy just graduated of one of the better medical schools in the US. What are we talking about? That is absolutely insane to me. You're going to throw away 5,000 years of medicine, and we've been tinkering around with drugs derived from oil. The same guys who own the oil own the drug companies, and you can't figure out that's a problem. So anyway, I digress.
Yeah, it's very frustrating because, there are so many sick people that remain sick for years and even decades because they completely put their trust in Western medicine. And hey, all I can say, there's a place for drugs. I like drugs when they're needed. Vicodin was just saved me when I would have been an absolute mess when I had severe lower back pain. And, if I get in a car accident, I want, Western medicine, emergency medicine.
Oh, sure.
Absolutely.
If I'm in some kind of trauma, there's no place I'd rather be in the world than right here.
Yeah,
that's for sure. But when it comes to chronic illness, they're just, and their hands are bound. Some of these doctors, they're really good people, a lot of them, but they're afraid, they'll lose their license, their livelihood, or their life for that matter.
Yeah, absolutely. Yeah. And that's a very good point that people are, fearful, or they've got their medical bills to pay and the family support. And, I totally get it. They're handcuffed.
Yeah, I hear this a lot. They've got a term for what happens when the people come see me, leave pain-free or symptom-free or whatever, and go back to see their medical doctors. And I'm sure you might have heard this term before. They call it a spontaneous, miraculous healing. Yeah, spontaneous, miraculous healing. It's not anything else. It's just random.
Yeah. It's interesting that I've heard of people also going, like they're detoxing and their symptoms will get better. They do bioenergetics or something with our business, with Myers Detox, and then go back and their doctor just poo-poos it completely. But it's like, it's just placebo, or that's just a bunch of nonsense. And I've had, it's just really interesting, the reactions.
Yeah. It's funny when, because I have had plenty of people, good friends of mine, in fact, come over and they'll just let me work on them kind of to placate me, I think, they have no expectation of this working because they've been in pain for a long, long time and seen all the medical doctors and whatever, and then I'll fix it in just a few minutes, and they're like my one buddy, I had fixed his knee that had been hurting him for a couple of years, some kind of motorcycle accident or something. And I did it in like 4 minutes, right? And zero pain. And so he's walking around and he's like, this has to be a placebo. This has to be in my head. And I looked at him and I'm like, does it matter? Do you really care? You don't have any pain anymore. Who gives a crap? You know?
Who cares how it happened? As long as it's
for real,
gone.
Man. I stopped a 36-hour cough I had one time. I think it was a mold exposure. I was walking back from my office and I literally felt something go up my nose, right? And then like 60 seconds later, my whole head stopped up on these crazy wet sneezes. And then a couple minutes after that, this really loud, dry cough going on for like 5 minutes or about every 5 minutes. And this is 36 hours straight. And I'd gone down to Atlanta to see my friend Jennifer Gramuth, who she's another one you should really talk to. She's probably one of the better lymphatic therapists in the country, if not the world. She does a whole lot of detox work too. So I think you'd love her. She's just a wonderful human being. But so she and I are friends, and I went in a day early to kind of hang out and, learn a little something else from the training class that we were doing. And she noticed this cough obviously right away. And she's like, hey, let's see if we can do something about that. She types into her little app, like cough, and so a bunch of acupuncture points come up. She pulls out this little laser pointer and there's, did a lung point here, the lung one up here, like just little circles about the size of a dime, right? For about 30, 45 seconds maybe, and gone. My cough stopped. I think I let out 1 or 2 more coughs and it was out. About 12 hours later, when I was at my hotel room, like 9, 10 o'clock at night, I suddenly started coughing again, but they were really wet and I was coughing up all this crap, very different. And then that lasted for like a few minutes and it was gone permanently. So I've used that little laser trick. You were asking about energetic tricks. That's an awesome one. You can use for all sorts of things. I've gotten rid of severe anxiety with people, like people were about to straight up go into a panic attack. And then they're pretty much back down to normalized, It's super cool.
Interesting.
Yeah.
Interesting. Well, Michael, this has been such an interesting conversation, and I wanted to thank you for coming on and really encourage anyone listening, if you have any kind of like any issues that just you haven't been able to resolve, or you're in pain, intractable pain, please give Michael a call. You won't regret it.
Yeah, I get people coming from all over the country now. In just a year and a half, almost 2 years, I've had this place open. It's been pretty cool. Thank you so much, Wendy. It was great talking to you.
Yeah. And thank you so much, Michael. And everyone, thanks so much for tuning in to the Myers Detox podcast. My name is Wendy Myers. You can learn all about what I do detox at myersdetox.com. And thanks for every week for tuning in. It's just such a blessing to bring you guys all this information to help you meet your health goals and improve your life. That's just all I want to do, is to help you dramatically improve your life and your health.
Same. We're all on the same page.
Yes. So thanks for tuning in, and I'll talk to you guys next week.
The Myers Detox podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.